Hello, my name is Mike Relf and I'm the Assistant Chief Executive at Avon and Wiltshire Mental Health Partnership NHS Trust. This talk is about our plans to become a Foundation Trust. At each of our consultation events, a short presentation is being made telling those attending a little about us and signposting the different elements of the way we propose to operate as a Foundation Trust. This is an audio version of that presentation, which you can listen to at your leisure. Formal consultation started on the 1st of September and will continue until the 26th of November 2009. We hope that you'll be enthused by what you hear and that you'll want to get involved and perhaps become a member or even stand for election to the Trust's Board of Governors. In the next 20 minutes or so, I'm going to summarise what we do as a Trust, explain why we think becoming a Foundation Trust is a good idea, and outline how, by going down this route, you can have a greater influence on how we provide mental health and social care services in the future. I shall also highlight the particular areas where I'd like your views, and where the stands around the room at each event will give you the opportunity to comment specifically on, for example, issues surrounding membership and governors. Hearing what you say is vitally important to us, and this is the key reason for holding consultation events. Who we are. We're known as Avon and Wiltshire Mental Health Partnership NHS Trust. Most people call us AWP. What do we do? Everything we do is designed to achieve our vision, and that's enabling and empowering people to reach their potential and live fulfilling lives. Everyone at AWP strives to deliver the highest quality of service, and in doing so, their efforts are underpinned by the Trust's values. These are listening, challenging stigma and promoting equality, being accountable to our communities, and harnessing the enthusiasm and skills of our staff. Our vision and values have been established as a result of much discussion and debate within the Trust. One of the benefits we see of becoming a Foundation Trust is that all those who become members will have an important role in helping us to achieve our vision and our values. In addition to making sure that we live up to these values, we are and will remain an integral part of the National Health Service. The values which have shaped the NHS also guide the behaviours that you can expect from our staff, and for them to follow in all dealings with service users, their carers and members of the public. We support and provide services to a lot of people, ranging from those who may only need our help occasionally, through to those who have a mental health need which may require support for the rest of their lives, such as those suffering from dementia. Supporting older people and those of working age has been the traditional work of a mental health trust such as ours, and we deliver these services across our area. In addition, we provide mental health support for children and adolescents, for those suffering with drug and alcohol misuse, and for those with learning disabilities. We also support the criminal justice system by helping to care for those who have been convicted of criminal activity and have mental health issues, or, for example, those who need to be looked after in secure accommodation so they don't injure themselves or others. Whatever the type of care we provide, our aim is to get people back to good health as soon as possible, and so enable them to live normal lives with their families and their friends. What we do. We provide services and support over a pretty large area, some 2,200 miles, covering North Somerset, Bristol, South Gloucestershire, Bath and North East Somerset, Swindon and Wiltshire. We are one of the biggest mental health trusts in the UK, and certainly the largest in the South West. We divide this territory into 6 areas, each of which matches the areas covered by the local authorities and the primary care trusts, so that mental health and social care services are delivered in a coherent, joined-up way. Across this area, we operate out of 15 inpatient sites and 90 community bases, and from here many of our specialist teams work. Wherever possible, we try to support people either in their own homes or as near as possible to their homes. And all the evidence suggests that this is the best approach to help people to return to full health. To provide the support and care needed, we employ highly committed, capable and caring people. In total, we employ some 4,000 staff and manage a budget of approximately £200 million. As I said earlier, we also devote a lot of resource to combating mental health stigma and helping people to reach their potential and live fulfilling lives. And research shows that 1 in 4 people will experience a mental health problem at some point in their lives. That's 400,000 people in the area covered by AWP, and means that every and each one of us probably knows someone who has had some form of mental health illness. So, supporting people with mental health needs is crucially important. We do this partly by providing high quality and responsive services, partly through promoting mental health awareness and well-being, and partly by combating people's negative attitude to mental health, something to which you can all contribute. And that's why we signed up to support the national Time for Change campaign, and why last year we ran our own trust-wide campaign, Don't Ignore Your Mental Health. So that's a quick summary of our role as a mental health trust. But why do we want to become a foundation trust? Firstly, what is a foundation trust? Foundation trusts are not-for-profit, public benefit corporations, which currently provide over half of all National Health Service hospital and mental health services. They are autonomous organisations, free from central government control, but firmly part of the NHS, providing health care in accordance to core NHS principles. That's free care based on need and not the ability to pay. More importantly, a foundation trust is a membership organisation, and we want to recruit a wide range of members, from service users, carers, local people and our staff. Membership is free, and the amount of time which members spend supporting the trust is down to each individual. You can spend as much or as little time as you want. There are 2 formal consultation documents which have been produced and which provide more information. I'll talk more about membership in a few minutes, but first I want to highlight some of the advantages of being a foundation trust. Through people becoming members, much stronger connections can be built between the trust and local communities. It's much easier to find out what local people want, what they think we do well, and where they think improvements may be needed if we have a large number of people engaged with the trust as members. Service users and carers are also much more involved, enabling the trust to draw on their knowledge and their expertise to help shape services and delivery. And because foundation trusts are free from government control, they have much more scope to design their healthcare services around local needs and local priorities, planning for the longer term, ensuring that it's in tune with community wishes. Whilst recognising that there is scope for improvement, we think we are doing a lot of good work across the area. Everyone at AWP is working hard to do things better, to innovate and to find ways of delivering our services, making sure that quality is at the top of our list in everything we do. And quality is also one of the reasons we want to become a foundation trust. To become a foundation trust, we have to be recognised within the health service and local communities as delivering quality. It's almost a kite mark of quality which says, this organisation is very good.